Hello, and welcome to the DCH Health System. During this video, we will discuss your role in protecting yourself and others from healthcare-associated infections, or HAIs. The Centers for Disease Control and Prevention, CDC, is estimated that 1.7 million HAIs occurred in U.S. hospitals in 2002 and were associated with approximately 99,000 deaths. The overall actual cost of HAIs to U.S. hospitals has been estimated to be as much as $33.8 billion. These estimates are sobering and reinforce the need for improvement, prevention, and surveillance efforts. DCH follows the CDC guidelines and the Occupational Safety and Health Administration, OSHA, Bloodborne Pathogen standards. Let's start by describing what three things have to be present for an infection to occur. It is called the chain of infection. All three links in the chain must be present for an infection to occur. If you break just one link, you can successfully prevent an infection. There is one link in the hospital setting that is more controllable than the other two. One of the links in the chain represents almost every hospitalized patient, a susceptible host. For example, the very young and the elderly, those with an impaired immune system for any of the numerous reasons such as chronic underlying lung disease or cancer, or someone with something as simple as non-intact skin due to a wound, injury, or surgical procedure. Two things that are often done to patients that increase their risk for infection are IVs and urinary catheters. The second link in the chain represents an infectious agent, which could be bacteria, viruses, fungi, or parasites. And we all know germs are everywhere. Some are even good for you. The third and last link in the chain of infection that has to be present for infection to occur is a mode of transmission. This is the area we have the most power to impact. Infectious agents have the potential to be transmitted via the following routes: bloodborne, airborne, droplet, and/or contact. As mentioned, DCH follows OSHA standards. The purpose of these standards is to provide a safe workplace for employees and limit exposure to bloodborne pathogens in the work setting. This is accomplished through work practices and environmental controls. One of the most important practices is called standard precautions. Standard precautions are meant to reduce the risk of transmission of bloodborne and other pathogens from both recognized and unrecognized sources. They are the basic level of infection control precautions, which are to be used as a minimum in the care of all patients. This means you wear barriers as appropriate for the situation. For instance, if you are drawing blood or starting an IV, always wear gloves. If you're going to be assisting in a procedure where splashing may occur, be sure to wear gloves, gown, goggles, and a mask. There are many bloodborne pathogens or disease-causing microorganisms that are present in human blood and other body substances. The three most common and serious are HIV, hepatitis B, and hepatitis C. Note the risk of acquiring diseases from a needle stick of an HIV-positive patient is less than 1%. For hepatitis C, it is approximately 1.8%. Hepatitis B ranges from 23% up to 62%. This is why hepatitis B vaccination is so important. It is a series of 3 shots administered as a part of the immunization schedule for children in the United States. Hepatitis B, post-exposure prophylaxis. If the exposed person has not been vaccinated and the source of exposure is known to be positive for hepatitis B, shots would be started and an immune globulin shot called HBIG would need to be started within 24 hours for best protection. What should you do if you have an exposure? The first thing you need to do is perform first aid. Wash the area with soap and water, or if it was a splash in the eye, irrigate with saline. Then fill out a work injury report and notify your supervisor. If you know the source of the exposure, be sure to put the patient's name and D number on the report. During regular hours, employees report to employee health, or if it's after hours or on the weekend, report to the ED. All non-DCH employees should know and follow their employer's or school's policy for follow-up. The Exposure Control Plan is located on the DCH intranet in the DCH Plan section of the Policies and Procedures tab. It describes in further detail the employer's responsibilities, employees' responsibilities, who is at risk, the procedures and practices in place to protect you, and what to do if you get exposed. A work practice and environmental control is the availability and utilization of personal protective equipment, or PPE. These caddies are located in hallways throughout the hospital and on some patient room doors. They contain gloves, gown, mask, and goggles, so anytime you need PPE, it is readily available. They are not just for use with patients in isolation precautions, but to be used as indicated for standard precautions. Another healthcare work practice and environmental control created by OSHA is related to hazardous waste and potentially infectious material. The rule of thumb is that the amount of blood generated is enough to drip. It must be placed into a red trash bag. On the right is a picture of a biohazard bag. It is used for transporting specimens to the lab. The color red and the universal biohazard symbol signify potentially hazardous waste, blood or body fluids. Safety needles and safety sharps are provided to help protect from injuries and exposures. Immediately after use, all needles, syringes, and sharps should be placed into a needle box. The CDC has environmental cleanliness guides that the DCH health system follows. Environmental cleaning is the key to a germ-free environment. The Environmental Services Department uses evidence-based practices and protocols to ensure patient care areas are properly disinfected. However, keeping the environment clean is everyone's business. The X's in this picture represent areas that can become easily contaminated and therefore could result in cross-transmission. These are referred to as high-touch surfaces and should be sanitized frequently. Disinfectant wipes are available in all patient care areas for the convenience of all healthcare personnel. All equipment and devices should be cleaned after use between patients. A clean environment is a patient safety issue. Hands are the way almost every germ is transferred from one patient to another. DCH complies with current CDC hand hygiene guidelines. When hands are visibly dirty or soiled, wash with soap and warm water, working up a generous lather by rubbing your hands together for at least 20 seconds. Otherwise, if hands are not visibly soiled, you can use alcohol-based hand rub for routine decontamination. Be sure to cover all surfaces of your hands and continue rubbing your hands together until all the product has dried. DCH policy is no artificial fingernails for healthcare workers who have direct contact with patients. Nail polish must be kept in good repair to minimize its potential to harbor microorganisms. Natural nails should be kept short, less than 1/4 inch long. If organisms or germs were like color-coded candy, imagine it would look like this. But remember, it is the germs you can't see that can make people sick. Hands can become contaminated by doing the simplest of things: taking vital signs, assisting with mobility, helping them down the hall or to the restroom, touching a patient's gown or sheets, and touching bedside equipment. Our patients deserve 100% hand hygiene compliance, so remember, gel in and gel out. Clean hands really do save lives. In addition to the practices of standard precautions for all patients, some patients may need to be placed in one of the 3 additional types of isolation precautions: contact, airborne, or droplet. If so, the appropriate isolation sign will be put on the patient's room door. Each sign has pictures and instructions for what PPE and precautions must be taken. Patients that need to be in contact precautions, for example, are patients with C. diff, scabies, lice, MRSA, VRE, and other multi-drug resistant organisms, or MDROs. Anytime you go into the rooms and you're going to come in contact with a patient or the patient's environment, be sure to put on your gown and gloves. Remember, you are not only protecting yourself, but the next susceptible patient. These are pictures of patients with infections caused by MRSA. They happen to be community-acquired MRSA, but could easily become hospital-acquired if germs were carried on someone's hand from one patient to the next. Other examples of MDROs requiring contact precautions are ESBLs, extended spectrum beta-lactamase producers, and CREs, carbapenem-resistant Enterobacteriaceae, and these bacteria do not respond well to commonly used antibiotics and therefore can be deadly if causing an infection. Who goes in droplet precautions? That would be people with the flu, bacterial meningitis, pertussis, German measles, or the mumps. And for protection, you would use a regular surgical or isolation mask. It should be put on before entering the patient's room. Organisms in this category are considered ploppers. They can project out approximately 3 feet before falling to the ground, and spread can occur with talking, sneezing, or coughing. Who goes in airborne precautions? That would be patients that have or have a suspicion of TB, chickenpox, or measles. Entering these rooms require a specially fitted N95 mask. These organisms are considered floaters because they are so small they can be carried around in air currents. Only specifically designed rooms can be used as a negative pressure room, which is required for airborne precautions. This nurse is getting ready to go into the negative pressure airborne isolation room. She is putting on her fit-tested N95 mask. The blue airborne precaution sign is on the door. This room has an electronic monitoring device that must be turned on with a key. It will alarm if the room is not pulling negative pressure. Per regulatory guidelines and hospital procedures, you must also perform a tissue test where you place a small piece of tissue at the bottom of the door. It should pull the tissue into the room. If it blows out or just drops to the floor, then the negative pressure needed is not working. Facilities maintenance should be notified. Now you are empowered. You can help prevent the spread of germs, share your knowledge, and prevent infections. If you have any questions, you can reach the DCH Epidemiology Department at 750-5267.